These two people that many of you, again, know, they also are community heroes and leaders, are going to each talk about how they had a family member that died really as a result of poor health care. And let's start with our brother Kimon. Good morning, Kimon.
Yeah, it's an honor to be with you and also with Dr. Chapman and your other distinguished guests. Good morning.
Yes,
Good morning.
and I'm always shocked when I meet people who don't know Kimon. It shocks me, but Kimon, in one sentence or two sentences, tell people who you are.
It's Kimon Freeman, angry black man in therapy, artist, activist, co-founder of We Act Radio on the radical side of Martin King Avenue, and also a D.C. statehood Green Party candidate for D.C. delegate to throw Eleanor Holmes Norton a retirement party in November.
Yes. So, Kimon, you have, of course, much to say about many things, but some people may not know about the story of your sister. If you can share what happened and how her death was really a result of corporatization of healthcare.
Well, first, let me point out the fact that we are in a nation's capital where this is the most dangerous city in all of America for a black woman of any social economic background to give birth. We have the highest maternal mortality rate in the country. And we have a black woman as mayor, a black woman as congresswoman, even a black woman as chief of police. But yet they're not addressing this crisis. And it's just, it shouldn't be acceptable. The fact is, since the Columbia School of Women closed, DC General's closed, since the criminalization of midwives, assistant births in this city, but instead of addressing the highest maternal mortality deaths in the country, we have found our leadership advocating the military industrial complex to name the first nuclear submarine after the District of Columbia. This is the problems that we have. I want to make sure we're aware of that. Now, today is July 8th. It would have been my sister's 51st birthday if she was still with us. If she did not confuse, as many people do, with health insurance and health care. They're not the same thing. Insurance is just that, insurance. They cover some things they won't. You may be left out in the cold with a thin sweater with insurance. We need health care. And what happened with my sister, she was in a car accident. She was T-boned. She wasn't seriously injured, but they did have to cut out the car because she was pinned. Her insurance stipulated that had she gotten to the hospital unconscious, they would have been required to do a full body examination on her. But because she was conscious when she arrived at the hospital, they was only required to provide care to her express elements. She was complaining of her shoulder and her neck. So they addressed that. She went home undiagnosed with a small fracture, a millimeter fracture into her liver. She was dropping like 2 or 3 drops of blood. Had she been examined, rather than the profit sharing, the profit cost effective approaches of the insurance company to say, well, why would we do a full body examination? Because 2 out of 100 only need it. So 98 out of 100 is unnecessary. So for the 2% they're willing to deal with that. And she was a victim of that. So when she went home undiagnosed, a few months later, she collapsed in her home and she died on an emergency operating table. And when my family tried to sue, the insurance company threw everything at them but the kitchen sink, including the kitchen sink, I should say. But there was a very ethical lawyer that told my mother that he could not, in good faith, accept her little $5,000 retainer fee if she wasn't prepared to spend $50,000, because that was what it was going to take to get them across the finish line and their day in court. And he warned her that even if she did that, and that even though she's right, and he believes her to be right, that she could still possibly lose. And if she lost the case, the insurance company would then countersue her for more than $50,000 that they spent on their lawyers, and she could lose her house and everything she worked for. And this is how they keep the 2% out of their 100 quiet and silent about their suffering, and business as usual continues.
Kimon, tell us what year we were sending your sister blessings on the day that she was born. Tell us what year was she born?
My sister was born July 8th, 1973.
1973. And what year did she leave us physically?
She left She left us in 2017. She was 44.
Well, we're thankful that you are sharing her with us. Say her name again.
Her name was Latisha Bryant.
Latisha Bryant. We applaud you, and we're thinking of you on the day of your birth. We're thankful you're on the air with us right now. Let's see. We have time now, I think, to jump right into Pam Parker. And again, you just heard Kimon Freeman. Those of you who do not know Kimon, shame on you. He's an activist that you should know, does many things, and we're happy that he's here with us in this fight for health care for people and not-for-profits. But Dr. Busey or Dr. Chapman, do you want to comment or continue on where we left off?
Yeah, I'd like to comment on both of these cases. It brings up large issues on some of the weaknesses in our healthcare and what the corporatization has done for decision making. And I want to talk about Kimon's case. And Kimon, listen, if I was a DC resident, I'd vote for you, but I can't. I'm in California. I appreciate both of you. The ER, I want to talk about the ER. I used to work in the ER. The ER used to be a place where you could do what Kimon said that his sister should have gotten, which is a complete evaluation. Motor vehicle accidents are very tricky. And what he described, laceration of a liver or whatever happened. Shoulder pain is a serious thing after a motor accident. It can speak to lung disease or anything in the internal organs. And this ER person was told or regulated not to do an investigation. That's professional judgment. You could say that's almost malpractice, that you're obligated to do a complete exam with a serious T-bone accident like you described. But the larger issue is how the ERs are flooded with people. There are so many people using the ER. The primary care system is out. The ER, of course, is for this kind of a situation. But because of the fact that many people were probably in the ER that day for minor illnesses, that might have also been a factor why your sister couldn't have had a proper evaluation. That's number one. ERs are flooded. Number two is what the ethical lawyer told your sister, which was, good luck. You're fighting against a ginormous insurance company, and you're in the malpractice game. Now, I'm a lawyer as well. I'm not active right now, but I've always fought for medical courts and professional jurors and taking the gamesmanship out of malpractice cases. And other states in this country have no fault liability. In medicine, it's not that way. There's so much money for the plaintiff's lawyer and the defense lawyers that the burden is put on the patient and the plaintiff to come up with this money. The premiums are so high that the evidence has to be overwhelming, and you have to be well funded to get what our Constitution guaranteed, which is life, liberty, and the pursuit of happiness. And when I say life, that implies health care, but that's not in our Constitution. So that this comes into the whole issue of medical legal liability. And this issue is also the administrator's liability, but they're not in that chain of commerce. It's the doctor and the hospital. But what if there was a world, especially with you, Pam, where the administrator denied providing the medication that indirectly or directly led to your son's demise? And so my dream has been to get legislation and bills to hook the liability on the people that make these terrible decisions. Why should it be the providers who are hamstrung by these policies? It should also be the administrators who make these policies that should be liable. And so that's what I jumped out about your son's death. I'm so sorry for your loss. And also Big Pharma, they're sitting there with billions of dollars. They could have easily provided that money.
Absolutely.
to get the medication for your son. So these are the mega issues that are really causing these problems: the flooding of the ERs, the gamesmanship of medical malpractice, and the costliness of getting into that game. There are solutions to both: medical courts, no fault liability, and also ascribing liability to the people who make these terrible policies. So that's what my observations are.
Absolutely. You're listening to WPFW. We're focusing on the increasing corporatization of healthcare in this nation, richest nation in the world. This is me, Joni. We're joined by two physicians, Dr. Chapman and Dr. Bussey, calling in from California. Dr. Chapman right here with us in the community. And two activist patients, Kimon Freeman and Pam Parker. And I must say, Dr. Chapman has emphasized that tomorrow night, one of the things that will be discussed is the critical importance of community organizing to fight for the healthcare clinics, to fight for a healthcare system, and not only community activism, but in the case of DC government oversight. And we'll talk about that tomorrow. We have these Unity healthcare clinics. The DC mayor, not to mention all the city council, should be right up front dealing with what is happening to this system of clinics that serve the underserved. But Dr. Chapman, what would you like to say in response to what Kimon and Pam said, or anything you'd like to say about what we can do to fight for a real healthcare system, not a system based totally on money?
So, thank you, Joni. And I think we need to look at a satellite view of what's really happening. You'll see ads on the television over and over again for what's called Medicare Advantage plans. These are private health insurance plans that came into the market primarily to compete with so-called fee-for-service Medicare, which was the only thing available in the Medicare arena when I started practicing. And you also hear about Medicaid managed care organizations. Again, often private entities that are sold on the stock market. So when we look at the overall healthcare system, imagine 5 to 10% of patients spend 50% of the healthcare dollars. And most of those patients are in the Medicare or Medicaid arena. So let's start there. And who's on Medicare and Medicaid? Well, senior citizens who retired, and of course with Medicaid before, black or white. And so that accounts for the largest portion of our healthcare system. And what has happened is these companies have gone after these patients because they know that there's very little regulatory oversight in most markets and most states. So you can imagine they really fight over getting these patients, and the reason is because they know that they can play corporate games and make money or take back money or underserve and keep money and without any regulatory oversight. So that's the big picture, and we call that cherry picking and lemon dropping. There's an article in the New England Journal that describes this. So these companies are very good at picking patients with a top of the line diagnosis like renal failure, but also getting those patients using AI and other methodologies to pick patients who are more compliant and that they're more likely to make money on.